Finding an effective angular cheilitis suppository is a priority when treating cheilitis. Infections are very common in the mouth and can be caused by many factors, including a vitamin or mineral deficiency, or by a reaction to a dietary supplement. In some cases, a simple change in diet can help to alleviate symptoms of angular cheilitis. The treatment for angular cheilitis depends on the type of infection, the type of fungus that causes the condition, and the specific symptoms. In some cases, over-the-counter medications are effective, but in other cases, you may need to consult a medical professional. If the fungus is the culprit, a prescription may be necessary. In addition to oral antibiotics, you should also consult with your doctor to ensure that you are taking the appropriate dosage. The cause of angular cheilitis is not always immediately clear, and many cases can be easily treated with over-the-counter medicines. In some cases, you may have to seek medical advice to determine if you need additional treatment. If you suspect that you may have a fungal infection, your doctor may prescribe topical antifungals such as mupirocin or fusidic acid. Applying the antifungal cream daily to both sides of the mouth can be effective, and the symptoms will disappear in about 2 weeks. The treatment for angular cheilitis will depend on the cause of the infection. Generally, over-the-counter medications will relieve the symptoms of the disease. In some cases, it is necessary to take some preventative measures, such as keeping the mouth well hydrated. The cause of the fungus infection must be treated as well as the underlying factors. If the infection is fungal, a topical antifungal can help. The primary treatment for angular cheilitis is to address the underlying cause. Once you determine the underlying cause, it will respond to treatment with a variety of home treatments. Once you've ruled out a more serious underlying condition, you can start with a treatment for angular cheilitis. It's important to remember that you may need additional care depending on the severity of the infection. The underlying cause of angular cheilitis is usually a bacterial or fungal infection. In some cases, angular cheilitis is caused by a bacterial or fungal infection. It can also lead to oral thrush, which is an asymptomatic infection. If it's a fungal infection, you may be prescribed a topical antifungal to combat the infection. You may also be advised to address the underlying causes. There is no single cure for angular cheilitis. It is best to use an antifungal ointment or topical therapy. An over-the-counter medicine may be effective for treating the symptoms of angular cheilitis. In some cases, preventative hydration can help relieve the condition. If left untreated, the symptoms may worsen. In many cases, angular cheilitis can be resolved by changing diet and treating the underlying cause. Once the cause is identified, a Cheilitis ointment is an excellent choice for most patients. This ointment will provide relief from the pain and swelling that are associated with angular cheilitis. It will not only help alleviate the symptoms, but also protect the mouth against dryness. Angular cheilitis is a common skin disorder that affects the mouth. It is often characterized by crusting, scaling, and erythema. Symptoms include pain, soreness, burning, and itchiness. Chronic cases can last for several years. An effective angular cheilitis suppository will help relieve the underlying cause of angular cheilitis. If you suffer from angular cheilitis, it's important to choose an effective ointment. It should address the underlying cause of the condition, including the type of yeast overgrowth and the possible weakened immune system. In some cases, a simple antifungal ointment may be all that is needed. An effective ointment should be gentle enough to not irritate the area. An effective angular cheilitis suppository should not contain alcohol, which can worsen the condition. The ointment should be applied to the affected area, and the skin should be kept clean and dry. Alternatively, a topical antibiotic may be necessary. If the ointment doesn't work, you may try the ointment made with castor oil. If you suffer from AC and want to look normal again, click the link in the description below to discover a natural treatment for angular cheilitis. Thanks for watching.